We want to welcome you to the Thriving Weld Summit. I'm Mark Wallace. I'm the Executive Director and Chief Health Officer for Weld County, so lead our public health efforts here. We want to welcome you to a summit that is a beginning of a translation from data that we've collected about the health of Weld County, move through conversation today, and ultimately into a next round of action so that we can continue to make Northern Colorado and specifically Weld County the healthiest place and the healthiest state. And hopefully at some time we'll be able to say the healthiest nation if we start community by community by community. What we want everybody to recognize is that health is everyone's business. Some people wonder about that, but it makes me feel way better having gone to medical school to get started in my career, that it's not only up to clinicians, and in fact we're learning more and more that it's up to a lot of other folks to help us achieve health in our communities. So we recognize that every one of you are part of that conversation. We want to gratefully thank our sponsors again. We've got a banner up here that recognizes them, but we want you to see them, and we want to thank them specifically for making it possible so that we could make this free of charge to come to, that we could be in a facility that would accommodate all of us to have great conversation. And so we thank all of these partners. We do have partners who helped bring us access to Wi-Fi, so you can go into the meeting Wi-Fi source and put in Alliance as your password, so you have a passcode, and that's what will get you onto the Wi-Fi. We're going to say once again, bathrooms to the left, and on the left, okay, as you head back toward the lobby. Cell phones on that vibrator mode are silent. Pay attention to where the exits are in case we're asked to leave quickly. Which way do we go? We don't have any lights that illuminate the way they do on the airplane, but you'll follow the crowds out the doors that say exit. And then just be mindful of who's around you and what's going on. We know in today's world we all need to be part of providing safety to one another. So let us know and let others know if there's anything that you're concerned about that's going on. We are really excited to start off our plenary today with someone who was here for our executive breakfast, someone who we are really pleased to have with us, as busy as she is, given all the activities that are going on with UC Health here in Northern Colorado, but particularly in Greeley and Weld County. Please join me in welcoming Marilyn Schock, who is the Chief Executive Officer for the Greeley Hospital.
Thanks, Mark. Good morning. There we go. Good morning. There we go. I'm a morning person, so I drive the rest of the world nuts. If you're not a morning person, I wake up around, normally it's about 5 o'clock. I have not adjusted to the time change. I said this morning. I woke up about 3:45 this morning and I'm ready to go. But my day's half over, so in about 2 hours you'll watch my head on the table. So thank you for being here today. I really appreciate the opportunity to work and live in Weld County, and I think from my perspective, it's how do we continue to make our community the best. And when we talk about health as everybody's business, it is. We have world-class health care in Northern Colorado, second to none in the United States and around the world in many places. Mm-hmm. Exactly. Thank you. We have the opportunity to have technology, to have great facilities, to have great care. It's not just the healthcare campuses that we see. It's all of the partners within the community that we get to work with. And that involves many of the folks who were here earlier on the panel when we talk about mental health and emotional health, when we talk about our federally qualified health centers, of really about making sure that people have the right care at the right time, the right place and the right cost with Sunrise and Salud. When we talk about very globally about how we take care of our communities, it's second to none. Our healthcare is amazing. But we all know it goes beyond what healthcare is about. It goes well beyond what we do in a community. So I want to talk a little bit about UC Health, and I'm not going to do an infomercial, but I want you to understand a little bit about how we come into the community every day. And we have been in the community from Greeley for almost 100 years with Greeley Medical Clinic. So UC Health has over 18,000 employees. We have 7 hospitals. We have over 5,000 either independent, aligned physicians or employed physicians. And we're in the state of Colorado, Nebraska, and Wyoming. And we work very closely with the communities. When I think about Weld County, it's that opportunity to say, how do we take it to the next step? And from my perspective, if you haven't been on Highway 34, the bypass, and you drive past that big steel structure, I'll tell you, the first time I came over that hill and I knew it was there, I was like, wow, that is huge. The reason we're coming into the community is there's a need, there's access, and it is partnering again with who we have in the community with North Colorado Medical Center, Sunrise, and all of the clinics, as well as you in the community. Our programs really work continuum. It's basically cradle to grave, was used this morning, but I will tell you, I think it's that prenatal to really end-of-life decision-making. And what programs do we all need to be able to make sure that we take care of our community? Larry Potoff this morning from North Range Behavioral Health talked a little bit about when we think about the physicalness of our injuries, and I use the example, I don't know about you, but some mornings when you put those feet on the ground and you think, ugh, I am sore, what did I do? And then you realize part of it's the aging process, and then how that engages you all day long if you're sore and painful. It really ties together closer than what we know. And so when we talk health, we have to talk about physical, emotional, spiritual, behavioral, and economically, because the communities have to be economically strong to be able to support the programming that we need. My main focus is really about the networking. One of the goals of today is celebrate the partnerships that we have and explore and gain new partnerships. And that's what we need to do today as we're looking at the information that will be presented with our needs assessment. It's how do we partner? How do we all come to the table and make a difference for our communities? It is the united way when we talk about the collective community impact. It is the sunrise when we talk about access. It is the SAVA when we talk about the other types of trauma. Every one of us in this room has a drive to make our community better, or you wouldn't be sitting here. And that's the piece that I find, that's my passion. That's what gets me up in the morning to think, wow, I get to work with an amazing community, group of people to say, how are we going to help make a difference for one person, for 2 people? Our community is going to double in size. And when we think about the number of people that are being impacted, we have to be there as organizations and community members of making a difference, partnering with the school district, partnering with the health district, the public health. When we think about Colorado Access, when we think about North Range, I can go very globally, but it's not naming one, it's all of us collectively. Some of our programs that we do really takes that into account, and I want to talk about one program of just an example to be able to say, how do we get there? Because I think a lot of the questions that come is, how do we get there? How do we make this the healthiest community to live, work, and play in? And that's a big question. But if we really take a step back and think about what's my role, it's every one of us doing something, that's the piece. We have a Healthy Kids and a Healthy Hearts program, and I told one of the stories this morning, but I'll talk a little bit about another one. When we talk about the programming of making changes cardiovascularly as well as physically and hitting the emotional components, there's real outcomes. We can't just do programming to program. There has to be impact. There has to be outcome and results. We have to see that we're moving forward. Dr. Wallace made a comment this morning that is resonating with me very loudly. Communities that engage and act on their information and data about health, put programming into place, collectively come together to drive health, are starting to see the outcomes and effects. And that's the piece that's exciting to me is we're not starting from square one. So much work has already been done, and many of us in this room, if not all of us, have had a role in that with our communities. So when I talk a little bit about even our lifestyle health, we saw a 20% improvement in cardiovascular fitness. We had 500 people go through the program. We saw a 10% improvement in strength, a 31% improvement in overall confidence to exercise. When we think about confidence to exercise, it's not going into a health club. It's going out and getting on a bike. It's using our great trails. It's all of the pieces of actually the confidence to get out and move. And oh, by the way, when you're out there and you hear the birds sing, doesn't it do something here? When we feel better physically, we feel better emotionally and mentally. We had a 68% reduction in stress and anxiety. Larry talked this morning a little bit about that employee who comes in that can't tell you that they've been having anxiety moments. They can't tell you that they're depressed and why. But it's impacting them not only in their work, but in their play, in their personal life, and that ultimately impacts the community. We had 274.5% of the program investment, and this was with the Poudre School District, was recognized through cost avoidance by year 2 of the program. So I link that back to what Dr. Wallace was talking about, is we're on our way to really setting up the community for health. Define health. I think everybody knows if you've had a day or two without health, whether it's the flu, you have a chronic condition, that day is not a very good day. We're granted our health. Without health, you have nothing. And so I'm way excited today to have a great day to talk a little bit more and move into Weld County. How do we make this the best place, the healthiest place, in when we live, work, and play? Thank you. Thanks.
Well, thank you, Marilyn. That is really a perfect segue into this next round of conversation. We are talking about what is health? How do we define it? What do we mean by that? And in today's world, one of the things that I find very exciting about being here in Weld County is that more and more organizations, businesses, and communities are deliberately identifying a health brand that they want to be connected with. That says a lot. It says a lot because that's a demand from the marketplace, if you want to call it that. If I'm going to continue to live where I live and have my family grow up here, work here, spend most of my day here, I want it to be a place that gives me a chance to be healthy. I want a health brand. I want to live in that place that lets me live that. So as we move through, as we're having our conversation today, let's be thinking together about what does that mean? We've talked a bit as we got started about how we define health. It's very broad. It's not about our physical health alone. But what does it mean to move into a collective health brand here in northern Colorado? One of the things that I know we'll never be able to do is we'll never be able to get the Capitol, that gold dome down in Denver, out of Denver as far as legislatively goes. But you know what we can do? We can move the Capitol for health. It doesn't have to be in the big urban center in Denver. It can be right up here in northern Colorado. It can be based in Greeley and Weld County and our neighbors over in Larimer County, and we can own that, and we can show the rest of the state how we're going to do that. So let's get going with a little more conversation. Obviously, the challenge is too big. We've said that over and over again. We can't do it alone, so we've got to get out of our silos. And what we need to begin to do is this whole concept of collective impact. We can be doing what we've done historically in other communities. We're ahead of the game here in northern Colorado and in Weld County in particular because we're beginning to align our activities. But if you look at the top arrow, a lot of us were doing things where we're doing great work. There's no doubt about it. I don't want to say anything bad about a non-for-profit or a for-profit business for what they've got set as their mission and their goals and their activities. But today we know more than ever that if we don't begin to align them, we're not going to get to where we want to be. And we're going to leave a bunch of people behind. And we're going to end up with the first generation with a shorter life expectancy than the previous generation. And I know I don't want to leave that to my kids. That's a horrible thing. My parents delivered to me a society in which I was going to live longer than they are, but let's not have us hand off something less. So what we want to do is we want to end up achieving our goals, but we've got to align things together. And we happen to use the phrase collective impact. You can see all the arrows are still independent arrows, but they're moving in a coordinated fashion. They're going forward. And it really allows us to close that gap that gets referred to as the execution gap. Everybody's well-intentioned. Everybody's got energy. Everybody wants to make something happen. But yet, if it's not coordinated, we lose. We lose some of our energy, and we lose some of our ability to achieve the goal. So what we want to see is more and more emphasis on collective impact, aligning what's going on across all sectors, engaging in that conversation in a way where we can make it happen so that we can have health, we can have a health brand, we can be successful, and we can have thriving communities all around. One of the things that we want to point out that we're doing really well here is that we actually have made the commitment to move to a dashboard. Businesses have used dashboards for a long time. Certain industries are very much into dashboards, and it allowed them to know where they were, where they had to go, and what it was going to take to move there, and it assigned accountabilities to people. I know that when I did more hospital-based work, there was a dashboard that reminded all of us of our role to prevent hospital-acquired infections, and I had a role. And if I wasn't doing things correctly in the hospital and there was going to be more hospital-acquired infections, you can bet that my boss came and told me about it and said, Wallace, you got to get in line. You know, the next time we catch you not washing your hands, we're going to have more of a private conversation about whether or not you're on the team or off the team. We are starting to use that at a community level in a way that is really unique because we are using it very broadly. This is just an infographic about it. There are the dials in the middle when you're on their website to actually look at it. It's available to the community. The dials move, but these are the categories that we've thrown our activities into so we can look at our resources. We've created maps like this. One of the things that we know we have to do better when we're working as a community is we have to put a roadmap out there. Otherwise, I don't know if I'm driving the same way that you are. How am I supposed to know that I'm in that big arrow moving the same way as you are? I may have my own map. I like Siri. She tells me where to go. But I got to get Siri to start telling me, am I on the right highway? Am I at the right place to get to this outcome of health? So these kinds of maps are built into there. So how are we doing a little bit? Where are we starting from in trying to create this next level of health branding for our communities here in Northern Colorado and Weld County? This is just a little bit of a teaser about some of the things that we're measuring. This is the bucket of healthy eating. The wheel that you see up there has some green, some yellow, and some red. We're not hiding anything here. We're not embarrassed about yellow, and we're definitely not going to hide red. All right, I keep telling our teams and our communities that I get to engage with, do not be afraid of red. We all want to put our best foot forward, and all we want to show is the data that makes us all look like we're perfect. Well, I'm not perfect. My kids aren't perfect. There's some things about all of us that's not perfect. Our organizations, our goals, what we're achieving. So this is beginning to show, where are we? Well, the green part, 42% in the healthy eating bucket, we're actually meeting or exceeding the targets that we set for ourselves. That's really good for a beginning stage of what we're doing together and being honest with one another about how is our work aligning. So we see things with children's fruit and vegetable consumption, meeting some targets that we set. Children's sugary drink consumption, a lot of collective effort going into that, recognizing what it means to our youth to consume sugar-sweetened beverages. We're actually at a positive trend, going the right direction with that. That's a huge success. We've got some places where we're getting close to our target. That's the yellow, within 20%. Breastfeeding at 6 months, positive trend. Adult sugary drink consumption, adult vegetable consumption. It's the hardest to get, I think, my adult colleagues to put some color onto their plates. It's amazing. Where are we struggling yet? Where we're farther away with adult overweight and obesity and child overweight and obesity. That's going to take a long time, but let's not be afraid of it. Let's not be afraid that we're not there yet. Let's put it out there. Let's be sensitive about it. Let's plan what we're going to do. Some of these other measures, if we're moving the right direction with people eating better, well, we're going to get there. We're going to get there. Let's combine it with some other things. Let's put together active living. So again, 41%, we're hitting our targets. If we look at adult physical activity, not only does our work show that, but there's been some national data that talks about people in Northern Colorado achieving exercise goals. Hooray! That is fantastic news. We don't all have to own it individually. Let's own it together and say fantastic. We've got adults using bikes and walking, commuting, children's use of active transport, children's time spent in front of a screen on weekdays. That's a positive trend. We want to see that go down. We want people to get out and away from our screens. So going the right way. Some work, children's time spent in front of a screen on weekends, still a challenge. A lot of time away from school, other activities. Adolescents' physical activity, we've got to hit the mark a little bit better there, but we are getting closer to where we've set our goals. Again, active living and healthy eating are really intertwined, so the same thing about obesity. They both feed back to the same issue about, are we at a healthy weight? What about healthy mind and spirit? We've heard a lot about how interconnected our body and our mind is. We see that some of these targets that we have set in healthy mind and spirit, adolescent alcohol use, positive trend. Suicide hospitalizations, a positive trend. Adolescent suicide ideation, we're at the goals that we've set. Where do we have some room? Alcohol or tobacco use among adolescents, marijuana use, obviously, with the legalization. What are we facing with more easy access potentially to marijuana? Adults having not good mental health days. Not quite there, but getting closer and with a positive trend moving the right way. Adult social and emotional support, and adolescent binge drinking. Binge drinking is one of those things that we do struggle with here in Weld County. And so to see us closing in on some targets that we've set in our adolescents, that's very good. Adult binge drinking, we're not as close. Teen suicide deaths, we're still not as close as we want to be. But let's not be afraid of these targets. Let's celebrate where we're at. If you look across this, yes, there's a lot of different color on here. But let's not ignore the fact that we've got a fair amount of green. And for a first iteration of doing this together, we've been through the first 3-year cycle, working really hard to get this aligned. This is good work. So let's give ourselves a pat on the back and not give up, not be afraid of the reds and the yellows. Let's charge into those right now so that we can be certain that we don't lose the momentum that we have. So you're going to hear a lot more later if you're going to one of our breakout sessions that will talk about the data that we've collected here in Weld County. But let's just refresh us about our top 10 takeaways. Overall, the health status of Weld County's adult population is mixed. We can celebrate that more individuals in Weld County have some type of health insurance coverage than ever before. Costs and scheduling barriers still exist, so we're not out of that yet. We've not solved the issue about the cost of accessing healthcare and meeting the demand that is out there yet. So when you hear about UC Health saying there's a need here, there's a need for access still. We're not ignoring the fact that when we get sick, we want world-class care and we want it now. When we're looking for outpatient care, we want Sunrise to be able to help us if I have a health plan that has a high deductible. People are engaging in healthy behaviors, as I showed you, but not enough yet. We want to stretch ourselves and go even farther. Mental health conditions do challenge our residents here, so we're not immune to that here in Weld County or in Colorado. It does a lot to have lots of sunny days and warm weather, but that's not a solution in and of itself. People do partake in risky behaviors of smoking and drinking at levels that we would like to be able to impact as we move forward. We know about 10% of residents are using marijuana. Distracted driving is a problem. I see it every single day, and it scares the bejeebers out of me how many people are picking up technology while they are operating a motor vehicle or even riding their bikes. I almost got run into in Atlanta. I just got back from Atlanta. There was a guy riding his bike through Olympic Centennial Park, checking something, probably social media, on his bike. And I'm like, yoo-hoo! Look over here. Health status varies by where we live, our income and education level and other factors. We're hearing more and more that our zip code matters more than our genetic code, and we can't ignore that in our conversations and our collective work together. And then we know from our residents that have been surveyed that the environment matters as well. This morning we also mentioned that as we look at what we are facing in the workforce with our businesses, that 4 in 10 Weld County working age adults have one or more chronic conditions. And what are listed here are largely physical health conditions, but Larry reminded us that we've got to be very aware that we can't ignore the integration with behavioral health. So what we want to do is move into more conversation with people in our community who can provide perspective and thought here as we begin our convening to look at where we go next. What are the thoughts? What are they seeing what are their organizations, their line of business doing. And I'm very excited that we've got a great breadth on this panel, similar to what we had this morning. So we are, probably to make it easy, we'll just go down the row the way we're sitting and start with Aaron, who is the closest to me. To avoid lengthy introductions, reading everybody's resumes and bios, we're not going to do that. So you have them on the table or in your packet somewhere, and you can look at people's information. But I will tell you that I'm very excited to have Aaron Wooten come up here. One of the things we really wanted to have represented on our panel this morning was a small business owner, and a small business owner with a mission beyond their small business, a mission about their community. And I will tell you that Aaron is the one who will steep my tea and get my cafe miel right every single time. So I'm excited to introduce to you Aaron Wooten to come up and share his thoughts with us.
Good morning. I am honored to be here. It was humbling when Dr. Wallace asked me to speak to you this morning, and as I began to process what it is that I might have to share with a room full of professionals when it comes to the topic of health, I'll admit last week I had a bit of a moment. I thought, okay, I can talk about anything for at least 10 minutes, but there are some things that I think I can bring a distinct perspective to that might help shape your understanding and perception of downtown. Cranford's Tea Tavern, we've been here for 4 years, and I thought, I'm a storyteller by nature, so I thought I would tell a little story to get you to where we actually decided to open Cranford's. My friend Roger Brindisi owned Cafe Panache, and he called me in July of 2013, and he said, we got these blankety blank people out from next door. And I said, well, okay, what does that mean? He said, I want you to come and walk through the property with me and tell me what you think this place could be. And so I met him, and there's doors that connect our basement, and the electricity had been shut off, and people that had used meth and dealt meth had occupied that space. And that space had been a fully functioning brothel, and it was right downtown. It was not even 2 blocks from here. And I walked through, and it was disgusting. It was dirty. There were needles. There were rooms in the basement with mattresses. And we got all the way up to the top floor. There was a stripper pole from floor to ceiling. On it in letters read, "We support single moms." And we got to the front of the establishment, and Roger said, well, what do you think? What do you think this place should be? And I said, well, actually, it seems pretty clear to me. It's supposed to be a tea house. and he said, a what? And I said, Roger, this place is supposed to be a tea house. And he said, well, maybe you should open it. And I said, absolutely not. I had no interest in doing that. Well, here we are 4 years later. I own a tea house in downtown. A tea house that, from its origin, began to partner. We are a not only for-profit business, began to partner with a nonprofit called Love Made Claim. A friend of mine, Natasha, had begun this work, and she and a group of volunteers intentionally go into strip clubs, find women who find themselves caught in the sex industry up and down the 25 corridor up through Cheyenne and all the way down to Denver. And their goal is to impart value to these women, to communicate to them, you are valued. There is something more to you than meets the eye. And I just want to tell you that, to share that with you. That is her mission. And when we opened Cranford's, we thought that is something that we can get on board with. It is not only a reclamation of the space downtown that had been used in that very area of abuse and mistreatment of women, but it's a way of using that space to defeat those evils that are very real and very much at work in our community today. In a former life, back before Cranford's, I was a pastor of a megachurch. That's actually what brought me to Weld County. That's what brought me to Greeley, a city that I love, a city that I believe in. And I got to tell you, opening a tea house is not the best way to make money in northern Colorado. So why did I do it? I believe in community. I believe in people. I believe in downtown Greeley. And I know that most of you in this room can resonate with that. You've invested your life. You've been here and you believe it. But what is community? And this is why I thought maybe I've got something that I can share with you in terms of health. At a foundational level, each one of us and every other person on this planet, every person that you know, needs community to thrive. They need connectedness. They need people to believe in them. They need a way to touch lives and to have people touch their life. And so, for me, Cranford's is more about building community than building the bank account. It is first and foremost a place where people can come in and know that they are safe, that authentic, real, life-changing conversations can take place. It doesn't mean it has to. When Dr. Wallace comes in for his Cafe Miel, we don't need to necessarily get to the bottom of every philosophical matter that he might be contemplating, which I can tell you is many. But we can have that conversation. I have had the opportunity to talk through people's misfortune and loss and grief while pouring tea, while making a sandwich. I have had people minister to me while I was doing the same thing in ways that were life-giving. And I think when it comes to health, we need accountability, we need relationship, we need that connectedness, we need transparency. And whether that be in my business or in a conversation that you might strike up at a local supermarket, that is what people need in order to maximize what health looks like for them. Now, I can tell you all about what Cranford's does. We sponsor a run club, and we promote physical health as often as we can. From its onset, we have rewarded people with discounts if you bike to Cranford's. If you can show me on your Strava app that you ran today, I'm going to give you a discount on anything you do, because we want people to do that, and we want them to know that they are valued, that they're going to be rewarded for doing that. I can tell you that Cranford's makes all of our food from scratch, that we do it in the most healthy way that's possible. But that's my hope for most places. That's my hope that most people are putting their best foot forward. For us, we want to reward you for being active. We want to encourage you and provide you opportunity to be active. Now, unlike Dr. Wallace, I did not come up with a giant PowerPoint and presentation. This is my entire speech. So, community, connectedness, reward for healthy living. We collaborate with the city and with other private companies and investors. I think the city of Greeley, the Polar Pedal, something that happens every winter. Get out there in, Sarah Boyd, that's January, I don't know the date, I can't remember. Okay, thank you, that's okay. Put her on this spot. Yeah, so, but these are events that are taking place in our community just to encourage people to come out, and then we reward them for doing that. And I think when you talk about, from, again, a foundational level, getting people out, getting people active, and knowing that they're on the right track, being genuine, being authentic, those are the things that at the end of the day make a huge difference in the life of a person. Again, I'm so grateful to be here and really to share in this conversation. Thank you for your time today, guys.
So I hope that you got to hear about purpose and place and passion and patience, how we minister to one another. And I think Aaron's business is really a reflection of who he and his family are in bringing this to us. So I thought it was a really good perspective, and I hope we can engage in some conversation with Aaron beyond what we're able to do with his sharing with us right now. The next individual that we are really fortunate to have with us, not only here today on our panel, but also working in our community, is Renee Gonzalez. We have had the real pleasure of having Colorado Access in our community for a number of years now. Colorado Access is one of those companies that has really committed itself to being a healthcare company that looks at folks who are probably traditionally viewed as being underinsured, folks with Medicaid and CHIP and other forms of coverage. But one of the things that I personally have appreciated about Colorado Access is, while they are a company that is based in Denver, and sometimes those of us in Northern Colorado are a little leery of Denver-based organizations. We're afraid we're going to be told what to do and how to do it, like we're too stupid to get it. Colorado Access has never once done that. Colorado Access comes into community and wants to be a partner. And we've been talking a lot about partnerships today. And so a little more of a lead-in than I might have done, but I got the microphone, and I wanted to say thanks to Colorado Access. So we're going to have Renee come up and walk through his show here, his slides, and then we'll move on to Rhonda after that.
Good morning. I think Dr. Wallace took half of my presentation, so I'm not going to continue going into some Denver bashing, primarily because I think I have some VPs here from Denver visiting us today. I am a very fortunate person to be here and share the stage with Dr. Wallace, Aaron, and Rhonda this morning. I have some very interesting slides that I want to share with you all, especially around Colorado Access and what we've done. I'm going to jump back. I think I was tasked to talk about the importance of supporting local communities and challenges of inequity in health. Now, we've done a great job having a Northeast office. Dave Rassatter, he's our Northeast director, grew up in the community. I myself was raised about 6 blocks north of our location, so very much passionate about Northern Colorado, Greeley, Weld County, and the entire Northeast community. That being said, I have a lot of territory to cover, and Colorado Access does so as well. We cover the state's Medicaid, or Colorado Health First population, and that includes, for Colorado Access, is 3 regions around the state: Denver Metro, kind of Denver East, which is Green Valley Ranch and Montbello, and then this huge size of Vermont, geographically speaking, Northeast Colorado section. So how do we approach these local communities with such a large footprint that we have to cover and provide for our Medicaid population? Well, 3 things. First is, like I said, we have a Northeast office, and within the Northeast office, we talk about reaching out to providers and figuring out ways that they can accept Medicaid as part of their practice. Now, one of the things that we have to do is work difficultly with a lot of individuals and physicians and specialists, because they really don't want to get into that particular line of business. It's a headache for many. They just don't have the time and resources. So in addressing inequity for the communities in Northern Colorado, we have to understand that people that in Yuma, Colorado, for example, don't have the choices that they do in Denver, or the public transportation systems that they do in Denver. So we have to figure out ways how we can get our local families to specialists in the Northeast. And that's, for many of them, driving an hour to Greeley, or just trying to find that particular specialist, or even having individuals from Greeley driving to Denver. So we're trying to address this inequity in terms of having our leadership team reach out to physicians and specialists and practices to accept Medicaid. Number 2, we also have a team of care managers that go out to our communities and visit our Medicaid members at their homes. I attended these one-on-one visits, and really it goes through asking every family member about the social determinants of health. What are the issues outside of their Medicaid situation? How can we help them get to their physician? What is it? Do they need food assistance? We connect those dots. So that's another reason that we try to address kind of inequities. The third one is the kind of world I live in, and that's in population health. And so what we do is we use data analytics to really figure out what the trends are in our communities. So for example, some of the work that I've done is we found that we have fairly high teen pregnancy rates in the Northeast. In fact, twice the state average. We also have low birth weight babies, high rate of low birth weight babies. We also have high emergency departmental utilization, family income. We can pull this data at a population health level and figure out strategies to implement into our communities. And this is what works well, especially with the Northeast community. So we can break out, like Dr. Wallace said, we can break out our data by zip codes and really get into the specifics of where these individuals are and start implementing programs. And so based on this information, we then go focusing on evidence-based or promising practices that exist both on a nationwide level or practices that are going on currently at the local level. We just support them, add value, ways that we can help support these communities, these agencies, these clinics in Northern Colorado. So population-based programming, so what do? We do incentive programs. We help interactive voice recognition. Basically, we have them get phone calls or messages, which can be annoying, so we started moving into this text campaign world. And again, all this process takes some time. It has to be approved by healthcare policy and finance at the state level, but all this work, we're trying to reach out to our Medicaid population, and we found out that most of these individuals actually are tech savvy, and a lot of them have cell phones. So we're trying to meet them at where they're at, and what we're trying to do is coordinate with our local community programs and health systems and figure out ways where we can partner, because I can't do everything by ourselves in terms of Colorado Access and the support we have. So what we do is we partner with local health departments, we partner with local agencies. I talked about teen pregnancy rates. While we worked with a national program, and we implemented a teen pregnancy prevention program, which is evidence-based in a community in Yuma. We're now going to do this with 2 other communities in the Northeast. WIC participation rates are fairly high in the Northeast. However, if you break it down and you pull Wild County away from the Northeast and rural pioneer communities, we find that WIC participation rates are actually lower compared to those in the Northeast. So we're trying to figure out programs and promote incentives where we can help families utilize WIC or enter a teen pregnancy prevention program and so forth. So we have a lot of exciting work that we do at the population health level. We do like to talk about a high frequency, low touch approach. Basically, we're trying to handle a population-wide level of individuals, but with strategic intent in terms of using data and analytics to work with evidence-based programming. Finally, the last project that I've been working on, and it really talks about social determinants of health and what that impacts. I think it was Margot who talked about the social genome model this morning, and this is what the Colorado Opportunity Project is about, and this is what I lived in for the past 2 years. And what we mentioned, and Janine Trustrow, who I don't know if she's still here, talked about reaching families as early as possible. And I'm even gonna go further, Janine. I'm gonna go into the family formation stage and really impacting those families. And basically what this project does is they look at this social genome model from the Brookings Institute, and they said, we have a set of criteria that these families are self-sufficient, or they're out of poverty, or they're becoming very integrated with kind of the general community. So we reverse engineered what these individuals or what these families accomplish starting at the family formation stage, and we found these indicators to say if families meet a few of these indicators, they will begin to becoming on track to be successful or self-sufficient moving forward. So what we've done is we looked at the family formation stage, and each life stage takes about 2 to 3 years to implement. So it really takes a while. So it goes from family formation all the way to end of life. And what we've done is we looked at the family formation stage and said, all right, let's look at family income. Let's look at VITA or tax incentive programs for families, because that actually is evidence-based to propel families out of poverty. We also looked at attendance of pregnancy, and I mentioned that earlier about implementing teen pregnancy prevention rates. So all these impact graduation status, which is in the adolescent stage, and moving forward. But we know that the important part about this work is we need to start focusing at the family formation stage and start implementing evidence-based programs or promising practices at the community level with data and analytics, which I think Dr. Wallace has done a great job explaining and emphasizing. So based on that work, this is what we've been doing at Colorado Access for the past 5 or 6 years and continue to do moving forward. So with that, thank you very much.
Okay, so we heard about how Colorado Access works between persons and populations. One of the things that we know is that we don't want to lose sight of individual people, but we have to focus on populations if we're really going to change this dynamic of health and where we are as a community. And you could hear how through a variety of ways, through policy, promising practices, partnerships, that you can move in that space in between to be certain that we're focused on populations. And we have to be aware of where populations may have a bigger reach. The Colorado Health Foundation is using a lot of language today about putting health within reach of everybody. Well, putting it within reach of me is very different than putting it within reach of others who live in a different zip code than I do. I was able to have a career in which I could put health much closer for me and my children and the people around me. But for many of the people that I see in the office, that reach is really a lot farther, and we don't want to lose sight of those people as a population. And I want to thank Renee for sharing how they're doing that work. We're going to move on to Rhonda Solis, and I've got to tell you again, we have got some of us, you all I hope share this thought, but public education is so important. And I think that some of the unsung heroes in our communities amongst elected officials are school board members. School board members have that role that is so important because we turn our children over to schools most days. And we're very particular about what we want the environment to be like for our kids. And so we're passionate about both our praise, but also when we're unhappy, we make it known. And one of the things that I really think we need to congratulate the community on doing was recognizing what District 6 is doing by passing at the initiative yesterday in the election, something that has been a long time coming. So congratulations to Rhonda, to her fellow board members, to all of the staff in the district, to the superintendent, to all of the people who volunteer, to the parents, the kids, everybody, for making this community recognize the value that you all bring to generating health in our communities and good fortune later down the road. So thank you as an individual board member, somebody willing to step forward and do that, but also for what District 6 does. It is the largest school district in Weld County. We can't ignore its impact on the youth in our communities. And so we have invited Rhonda to come and share some thoughts with us about that part of what it takes in partnerships to move us forward.
Awesome.
Thank you. And from all of the board, we want to thank everyone that worked so hard to get 3A passed. It was actually a story in 4 years in the making. We had to turn this district around. We had to work on our relationships. We had to do that hard, tough work within our district with our teachers, and we did that. And then we have an amazing board. We have an amazing superintendent. And that kind of started the roadmap to really go after 3A. We were so close last year, but obviously there were some things that we missed, that we recognized that we had to work on. And a lot of that was just having one-on-one conversations with people about what's going on in our district. A lot of people held on to old memories, old myths, old arguments, and we had to go out there and have those face-to-face conversations and tell people exactly what we were doing in the district. And I think that process has gotten us to passing 3A and kind of shows the kind of work that we have been doing within the district. I was listening to all of the speakers, and I was really inspired with all the things that everyone has done and the people that are here in the audience with the same mentality of, it is all of us together. We have got to do this work together. It is no longer pull yourself up by your own bootstraps, because we recognize there's a lot of people that don't have boots. And that really is the conversation that we need to have. I can go through the list of stuff we do. Our mission is engage, empower, and inspire. We want all kiddos to feel that in our schools. We want to make sure that every kiddo is either career ready or college ready. We've started new programs to bring kids back into the system that quit school, and now we got them going to school right across the street from Ames, hopefully doing a certificate program and something that interests them if they don't want to do a 2 or 4 year college degree. This year will be our first class graduating with their high school diploma and an associate's degree out of Early College Academy. So we're doing some amazing work here in the district. And one of the things that I love about Dr. Pilch is that we've broken it down into different criteria: student learning and achievement, strengthening partnerships, climate and culture, operational and organizational effectiveness, and under those, each of those, there's priorities, there's a way to assess, are we really doing the work? How are we going to measure that? And really holding ourselves accountable to what we go out into the community to tell you that we're doing with your kiddos. We want to make sure that these kiddos feel safe in our schools and that they can be successful. When I was listening to Dr. Wallace and all the different areas of measuring where we are, we're obviously doing well because we're going in the right direction. And we just passed 3A, and now we're going to have extra resources to do that work that we're doing. What I challenge everyone here in this room, and I find a challenge for myself, is the conversation about racism. I've been a school board member for 4 years, and I still am invited to meetings and sit with people, and I still feel uncomfortable. I don't feel welcomed. I graduated from high school. I've been working for a small business. I'm in elective office. I've been on a lot of boards and commissions, and there's still moments that I show up and I don't feel welcomed. And I think to myself, if I could feel this, oh my goodness, then what must other people in our community feel? I have a son that I raised here. He went to school at Shawsheen. He went to Franklin Middle School. He graduated from Northridge, and he went on to Ames to get a graphic design degree. He's really into art. He loves art, but he's also into tattoos. When he graduated from Ames, he got interested in working at Goal Academy, which is another entity in our community that helps kiddos. And he works with kids, so he has to pass a background check. And this son of mine, who I'm so proud of, still has areas in this community where he's not welcomed or he can't enter. Even downtown, there are times that he goes out with his friends and his friends are let in, but he's not. So we have some tough conversations that we need to have in this community around this issue. And I know a lot of you already know this information, but we have to be showing courage and making others have that conversation even though it's uncomfortable. And I know that it is. And I know sometimes that affects funding if you bring up certain things in a certain way. But we have got to be looking at that red that Dr. Wallace talked about, and that is a lot of it. We have a lot of immigrant families. This community was built on the backs of immigrants. When it came to agriculture, when it comes to our meatpacking plant, when it comes to our dairies, when it comes to construction. And yet there is still a mentality in this community that they are less than. And even for us as Latinos that have been here for generations, that was even some of our perspective. Yes, I'm Latino, but I'm not that kind of Latino. And when we experienced the raid here in 2006, a lot of those Latinos that thought I wasn't one of those got lumped in there just because of their brown skin. So we have got to have this conversation. We have got to have courage to have this conversation because we can do everything that we can in our school district and make sure that these kiddos know that we love them and we want them to be successful. But what happens when they go outside of our doors and they're either told that they're a gangbanger, they're illegal, people that look like them are rapists. So we really, really have to be conscious of the conversation that we're having in the community around this issue. And we have got to be brave enough to have this conversation because other communities are going to have it too. And I want people to look at Weld County. I want people to look at Greeley. I want people to look at Evans and say, we were tough enough to have that conversation. It was painful. It was hard. But we knew we had to do it because of the work that we do every day. And if we don't do the work, those people that we're not able to help or made to feel welcomed or we're inclusive with, they still show up in our stats. They still show that we're not doing a good job. That's a reflection of us. So we have got to get to a point where we are courageous and we have those conversations. And as a school board member, I have been shocked at what we expect our kids to do. We expect them to stand up to bullies. We expect them to, when they see something, say something. We expect them to, you know what, I know that's where you came from and that's all you know, but I expect you to do something different. I want you to do something different. You may not have the tools, I'll help you get the tools, but I expect you to be different. And then I look at the adult examples that we have sometimes, and it's like, how do we do that? How do we expect that of these little people? And yet we, as adults, don't call out that bully. We, as adults, don't call out that abuse that we see against women. We let that go. So I'm hoping that all of us in this room that do this work with all of these different communities and that we care and we know it's all of us together can show that courage together and have each other's back and have those tough conversations instead of us having conversations behind the scenes saying, yeah, I know that's happening, but I don't know what to do about it. I don't know. We have to have those conversations. I thank you all for the work that you do because it affects our kids every day. And the lens I come from, I was a single mom. As a child, I grew up in dysfunction. It was an alcoholic family. I graduated high school, but I had a tough time. I went to the store and I was followed around all the time. I worked in a job where there were those gut punch moments where someone reminded me that I had brown skin. And I cannot tell you how many times I've jumped through a hoop and asked myself, okay, I hope this is enough. And then someone puts another hoop, no, that's not enough, now you gotta do this. And that's what a lot of these kids feel. We tell them, learn English, be a good student, be active in your community, don't get in trouble. And still there will be those gut punch moments that these kids have to face that remind them that they have brown skin. So I'm hoping all of us together in this room will have that courage to have those conversations and really change the way we deal with kids. Because kids know. They know it in the tone of your voice. They know it in the look of your eye and the way that you speak to them. They know. They feel it. And I've had tons of conversations with kiddos. And for as much as I think we've moved forward, the experiences that I've had as a child, they're occurring again and again and again. So thank you for being here. Thank you for all of your support for our kids, our families. It's amazing work. I know sometimes it doesn't pay the best, but what you get back is in your heart. And I know that's why a lot of you are here and that's why you do it. And I thank you. I'm here with you too doing that work. And I look forward to working with you for another 4 years as a school board member and increasing our partnership. So thank you.
So we heard about courage. Very important. This morning at the first panel, Marilyn mentioned that we have to speak up. We have to have the courage to speak up. And so we've brought this full circle around. We set an easy table today. Some of us said we want to have a conversation. We put tables out and we invited people to that table. We have to be conscious as we move forward about whose table it is, how people come to the table, how people determine the conversations that we're going to have, and that we understand the value of individuals' lived experiences in contributing to the work that we're doing. And so I really appreciate the message that Rhonda brings us about this, because without that, we could create stats that would average things out. And we don't want to average things away. I just came from a population conference in Atlanta where they talked about our need to be genuine with data. Because if what we do is we say, for example, in Greeley, that we want to create an average for a certain, let's pick a condition. And that average comes out to be, I'll make up some numbers here, but let's say it's 15%. But if what's creating that average of 15% is that we've got folks that have a 2% prevalence of that, but we've also got folks that have a 40% prevalence of that. And if what we let ourselves be fooled by is to be guided only by the average, we've missed the inequitable distribution of that and a disproportionate burden being borne by particular folks in our communities. And we don't want that. None of us want that. So I want us all to have the courage to continue our conversation. This has been better than I expected. You know, the panelists so far have really exceeded my personal expectations for where we would be right now. So what we want to do is we want to spend some time with some Q&A with this group of individuals. And what we're going to do is bring some microphones out. Perhaps I could invite Marilyn back up, because maybe there are some folks who want to ask a question to you. So if you could come and join the panelists up here. Raise your hand, and we'll have somebody run a microphone over to you. Feel free to ask a question or help us define sort of where we want to be. What does it look like to have a health brand and have health that's equitably distributed here in northern Colorado and Weld County?
Thank you to all of you. I have a question, and I know we have some city folks in here, but one of my questions that I have probably for the schools is, we talk so much about getting kids engaged, we talked about getting them active, but we know we have a population that can't always afford that. They don't have the transportation. We have an amazing recreation department where we have soccer programs and basketball programs and all different things for kids, but there's at a cost. So what is the school and the city? Are they looking at different programs where we can take some of those programs back to the schools? Or how do we start to create a more affordable, I mean, I know it's very expensive to run those programs, but if kids can't afford them, are we looking at that as an opportunity?
So one of the great partnerships and barriers that we saw was kiddos having transportation to after-school programs. And we were very fortunate for the city of Greeley and Evans to provide free transportation for all students, and they have access to the bus anytime, anywhere. And so that has really opened up some doors as far as transportation. I think we have to think a little bit outside of the box when we think about exercise. I was recently talking to kiddos in interviews, and we were trying to figure out, you know, you have these skills, but sometimes it doesn't feel like a skill. Like we had a kiddo that works with his family in the fields, and he's like, well, I don't know how I would put that like on a resume. And it's like, oh my goodness, you have work ethic. You know how to show up on time. So we kind of went through and listed all of these different skills that he had gained from that, and he had like no idea. And I think we have to be a little creative when it comes to exercise. There are things that kiddos do, whether it's chores, you know, playing with friends, all of those types of things we have to include, and not just put it like, well, you have to play an organized sport, or you have to ride a bike, or those types of things. We really have to open that up to, you know what, you're kind of doing some things. Here's kind of how many calories you're burning, or how much time you're spending exercising. How could we increase that at your household? And it could be, you know, everyday things. I take on another chore. I offer to walk a neighbor's dog. I mow the lawn. All of those kinds of things are exercise, and I think sometimes we overlook that. And in their mind's eye, it's like, oh yeah, I don't have a bike, so I can't really count. But you do count. You're doing some stuff. We just need to be creative on how we, you know, describe that and put that down. So.
you mind if I just add a couple more to that? The only reason is because I worked in after-school programming in my youth, and there are many alternative after-school programs that are low cost or free for many kiddos. The Boys and Girls Club offer programs, after-school programs. They also offer nutritional programs, so if kiddos can't eat or missing that evening dinner for whatever reason, they can eat at a Boys and Girls Club. The Jesus Rodarte Cultural Center, where I worked for the after-school program, we have continuously had after-school programming for kiddos and summer programming as well, also feeding our kiddos at that level. So there's also alternative options, and with that, there's exercise and activities incorporated in those after-school programs, and it doesn't cost anything. I think it's $10 a year for the Boys and Girls Club, if I'm correct. I will say one thing that I know just doing after-school programming is I think if we add promising practices or evidence-based after-school program that impact health outcomes, would take the step a little further, but they have a full plate on themselves, and I think the good thing is there is opportunities and alternatives for our kiddos that are low cost.
Okay, I realize that I am not a very good timekeeper, despite all the people around me who are doing a good job at timekeeping. We're going to have an opportunity for one more question, and then we're going to start moving people toward breakout sessions, because that's where I think we can have more conversation. But is there one more question that we have from the audience? Okay.
Hi, good morning. I actually had a question for Renee with regard to the indicators. And one of on the far right-hand side of your presentation, there was a line that said people living with disabilities. Can you talk a little bit more about that relationship with those factors?
Yeah, that's something that we are very kind of limited in terms of what we're trying to do in terms of impacting individuals with disabilities. That work is with healthcare policy and finance in Colorado Access, and it's new to us as well. So we're not doing too much work, I can say right now, with individuals with disabilities, but I know there's some conversations behind that. I know there was the reason why it was incorporated by HICPUF is because there is a strong voice in the Denver community to support and address individuals with disabilities. So I can't give you a good answer right now.
Yeah, that is a question that comes up over and over, not only in our communities, but in a lot of communities, and it's just particularly a challenge in communities as big as Weld County, where we've got 30 plus municipalities, all of different sizes, with different kind of resources and ability to deliver on sort of municipal directed transportation. But I think one of the things that we do have going on is conversation collectively around transportation. It's certainly part of our needs assessment. It's part of what we look at in our built environment and other things around the built environment. We know that healthcare organizations are confronting the issue of transportation. So there are different pockets. And again, I think what we want to be sure we're doing with our work is that as we look at that collective impact, we recognize how we put the puzzle together better than we're doing today, so that we don't lose sight of that. But we see lots of different organizations and entities being involved in transportation. We want to be sure that we collectively are creating a roadmap for what that would look like, and no pun intended around roadmap and transportation, but it just happens that way. So we would really like to have your continued input as that process goes on, and in some of our breakouts, perhaps there'll be more of an opportunity to talk about that. I need to have us pull this session to a close. I want to really ask that you join me in thanking our panelists and Marilyn as our plenary speaker. We have 3 breakout opportunities for you. One is listening to the community, findings from the community health assessment. That will be in the South Platte room. What does it take to make a healthy community? That will be in the Cash Laputer. And then the last is making a healthy organization, lessons learned, and that will be in the Big Thompson. All of those breakout rooms, when you exit here, you turn to your left. Some of them you'll be able to enter with one left, others you'll have to make another left and go around the corner out toward the front lobby. We will be starting those sessions at, we're supposed to be in them at 10:45, so we need to hustle around. So instead of a stretch break, you're going to get a walking break. Brisk walk to your breakout sessions. Thank you all.